Thanks for being here to listen to the talk today from topics on baby triple P that we're covering. All right, so there are the slides. So yeah, understanding your baby and helping your baby develop positive sleep habits. So that's the idea of the talk today. So first of all, becoming a parent. So there's a question, maybe a little bit as part of a joke, but should everyone require a parenting license before they can become parents? It's sort of the question. See if we can play this little clip.
I didn't choose my parents.
They chose me.
I hope they are nice people and take good care of me.
Are happy and smile a lot.
And we have a nice home.
Teach me the important things.
And love me.
Love me. Love me. I really hope they are ready for me. It's your choice, but it's my life.
All right, so it's pretty much just a good idea or video showing that it's always good to know what you're doing when you become a parent. So hopefully I can give you some good tips and advice today. So first of all, being a parent is a very exciting journey that so many people around the world go through, and it's pretty much a universal experience. So every parent will go through very similar things. And with that comes a lot of joy and happiness, and of course the incredible love that new parents have for their babies. But there will also be some challenges that you have to go through, and there could be some stress. And one that probably most parents can identify with is a bit of sleep deprivation that naturally comes with it. But one thing you can do to make this transition easier is to develop a positive relationship with your baby. So we from Triple P, we promote positive parenting strategies, and that's really important to promote babies' development, and it can help parents manage their baby's behavior. So in terms of if babies do something that you don't like, then there's positive ways in order to deal with that. So all this helps parents develop a positive relationship with your baby, even when things aren't going so well. All those strategies help babies feel more content and more happy, more relaxed, and they may be less fussy as well. So practicing positive parenting from the start can prevent behavioral and emotional problems later on. So for example, those terrible twos or tantrums that some kids go through, you can put in place some strategies from early on in order to minimize the risk for those behavior problems to occur. And of course, all that can create really happy, healthy family relationships. So one topic today will be on communicating with your baby, which is a very important aspect in terms of developing this positive relationship with your baby. So talk a lot to your baby. Use language that they can understand, so keep it simple. Talk about things in the present. So if they're looking at a toy, talk about the toy with them, and look at the toy, look at them as well. Describe what you are doing and what they are doing, because that can develop their language skills as well from straight away. And follow your baby's interests. So whatever they're looking at, describe it, explain what it is in a simple way. So if they're looking at a flower outside, if you're going for a walk, then describe, oh, this is a rose, look at this, it's red color, and isn't this pretty, and something like that. Just simple words, but something that keeps their interest, and just go along with that. So going back to communication strategies with your baby, so there's also several ways that your baby communicates with you. And there's lots of different signals or cues that your baby will demonstrate to you in order to tell you what's going on with them. So if they're hungry, they're going to cry, or if they're very happy, they're going to smile or look at you. So we're going to go through some of those. So it's very important to learn to understand what your baby is telling you, and that would help you decide what to do with your baby. So it'll give you some really interesting cues. So good communication between both parents and babies can help build the positive relationship as well. So it all goes together. So signals or baby's cues can be demonstrated by baby's facial expressions. They'll show you what what they like or what they don't like. So look at what your baby is focusing on, kind of sounds that the baby might make, and your baby's body movements. So for example, your baby might show you in different ways that they're happy and content and ready to engage. So that happens when your baby is calm, when they're looking at your face, when they're reaching out to you or turning their head and eyes towards you, when they're smiling, or when they're making certain sounds to you, such as cooing or babbling or trying to vocalize something. So those are some signs that they're ready to engage with you. Signals that show you that your baby is distressed or overstimulated include when your baby is turning their head away or pull away, tense body movements, back arching is a very big one, frowning, or crying and fussing. I mean, crying and fussing will tell you that something is not right in any of them. Signals that your baby is tired is when they're yawning, which is quite a common one, moving their head from side to side, clenching their fists, pulling their ears or fluttering their eyelids. Or sometimes they also put their hands in their eyes and sort of rub the eyes, would also be one. So of course none of those signals or cues are set in stone. Every baby has their own personality and their own makeup. They have different ways of telling you what they want, but those signals can still give you a broad idea about what your baby is telling you if you're not sure what's happening. But you as a parent, you're the expert of your baby, and you will learn very quickly what your baby is telling you. So all you have to do is just focus on your baby, look at what they're doing, and then after a while you'll know what to do. Okay, so the next topic is sleep, which I think is one of the major topics that parents might be concerned about. So sleep is obviously very important because babies who don't sleep so good, they have feeding difficulties, they might not learn so well or play actively or independently. And babies who don't sleep well are also more fussy and irritable throughout the day. So if you want to play with them but they're tired, they're just not going to be ready for that. And tired babies are also very difficult to soothe and get calm again. So you can't just put them down to bed and expect that they will fall asleep straight away, because as long as they're still fussy and crying, they will need some time to calm down first. And of course, if babies sleep well, then you as a parent will also sleep well. And that's very important, because if you as a parent are happy and your needs are met, then you're more likely to be able to focus on your baby and give your baby what they need. So how much do babies sleep? So that varies depending on age and your baby's individual needs, of course. So for example, newborns sleep randomly throughout night and day for about 16 to 20 hours every day. By 12 months, babies sleep about 11 hours at night and only 2 hours throughout the day. So it gradually shifts from the nighttime, from daytime sleep to more sleep at night. And they also start to sleep gradually less overall. So here's a nice table that might show you that. So newborns sleep about 16 hours in total, and that's approximately equal throughout the day and the night, and they might have 4 daytime naps. At 6 months of age, they only sleep about 15 hours together, but most of that is done during the night, and only 3 hours throughout the day, with about 2 daytime naps. And then just gradually less by the time they hit 12 months or 1 year of age. So things that you can do to promote positive sleep habits is, first of all, follow the Australian guidelines for safe sleeping. So that's important to ensure that you don't have the sudden infant death syndrome. So you can get a lot of information from the Australian guidelines. I'm not sure where exactly that is, but I can look that up for you and find out. One very important thing is for babies to learn to fall asleep independently. So you'll need to give them a chance to learn that. So the babies need to learn the skill of self-soothing. So you can't always just do them for them or keep them in their arms or breastfeed them, because otherwise they will always rely on you to do that. So provide minimum amount of settling for your baby to calm down, but then put them in the cot awake so that they can fall asleep by themselves. Another thing that's important is to emphasize the day and nighttime differences. So for example, during the nighttime, you want to keep the baby, for example, in the cot, keep the lights down, talk in a in a quiet voice or not talk at all. Whereas during the day, you can keep the noise level at a normal level. You can talk. When the baby wakes up, you can have some fun activities for them. Also make sure the baby's actually tired, so look for some tired signals. So if you think at 3 o'clock it's a good time for a baby to take a nap, but the baby is actually quite happy to keep playing, then they're not going to fall asleep. Have a bedtime routine for your baby. So, for example, at nighttime, give them a nice relaxing bath or baby massage. You can read them a story. And if you do that every night, then the baby will learn that it's time to fall asleep now. It's nighttime sleep. And again, place the baby in the cot sleepy, but still awake so that they fall asleep by themselves and they know that they've been put in the bed to fall asleep by themselves. If your baby has trouble settling, even after you've done all those, you can still use rhythmic body movements for your baby. So you can sort of rock them from side to side, or you can stroke their head gently, and you use some rhythmic shushing sounds. Okay, just go back. And if none of that still works, and the baby just gets more and more upset, you can take them out, settle them until they're calm again, and try again to put them back in the cot to fall asleep by themselves. Okay, so if you want to know more about the first year for your baby, you can consider doing a baby triple P program. And that will give you a lot of important skills and some knowledge in terms of what to do with your baby. So I'm currently running a research study on baby triple P. So if you're pregnant with your first baby between weeks 20 and 35, you can do the study free of charge as part of my, as part of the research. The baby triple P program is 4 sessions, so there's 2 hours once a week for 4 weeks. And then there's 4 individual telephone consultations once the baby is about 6 weeks old. And in return for giving the baby triple P program free of charge, I'll just ask for some responses on questionnaires. Baby triple P is also offered for anyone who already has their baby or who are pregnant with their second baby. They can also do the program, so it can be done during pregnancy or postnatally. And with this one, there's a bit more flexibility. So we're offering it either as part of a 4-session program, doing 4 weekly sessions, or also a whole day program where it's done on Saturday for the whole day, and then also the 4 individual sessions. Okay, so if you have any more questions, I'm happy to answer them now, but you can also go to our website for more details, or you can come to booth H30, which is over on that side, and you can take a brochure or talk to me further if you have any more questions about any of the programs we're offering.